Welcome everyone, and thank you for joining another GPI webinar. I'm Genevieve Alptrani. I'm the Community of Practice Lead for GPI, and we have a very exciting webinar lined up today highlighting parenting in Asia. On our panel, we have expertise ranging from academics, implementers, practitioners, and researchers based across Asia. The panel will delve into cultural considerations, political and social challenges, scaling considerations of parenting programs, as well as other key themes from their context. But before we get started, I just want to highlight a few housekeeping points. Please note that this event is being recorded and will be made publicly available. To avoid any disruptions, only the speakers, cameras, and microphones will be active during the session. And if time allows, there will be a Q&A session following our panel discussion. But also, please remember to use the Q&A section, which you find at the bottom of your screen, just to put in any questions, and our panelists will try and answer these questions as the session continues. And now I'd like to give a warm welcome to Professor Jeremy Lachman, who will be setting the scene for this webinar, and he'll be followed by the wonderful moderator for the session, Dr. Amalee McCoy. Over to you, Jamie.
Thank you, Jen, and just want to welcome everyone on this wonderful Wednesday. For those of you in Asia, good afternoon. For those of you in the same hemisphere as I am, in Oxford and London, good morning. And for those of you who may be joining from the Western Hemisphere, good evening or in the middle of the night. This webinar is a continuation of a series of webinars on scaling evidence-based parenting support within systems that is being hosted by the Global Parenting Initiative. We have just done one last month on our collaborations and other partnerships in Africa, and we're really delighted to have a wonderful group of panelists and experts who are going to be sharing their knowledge and expertise from China, Thailand, the Philippines, Vietnam, and Malaysia. Really a wonderful kind of array of different experiences, different challenges, and different opportunities that have been presented in the work that they are all leading in collaboration, most mainly with government partners, with other local NGOs and academic institutions, and really with the aim to scale parenting support to reduce violence against children, sexual, physical, and emotional violence, and to improve child well-being, learning outcomes, mental health of children and their caregivers. And I think that, before I hand it over to Dr. Amalee McCoy as our moderator, I just want to take a step back to kind of reflect on the fact that a lot of people, when we talk about parenting programs, have sometimes a challenge of understanding what is a program or what is a parenting program, and why. And just really briefly, just to say that all of us have at one point in time either been a parent or caregiver or had an adult caregiver who has taken care of us. Maybe that was one who was a positive source of caregiving and nurturing for us when we were children ourselves. And we all know that this is one of the hardest jobs that a human being can ever be asked to do. So it doesn't come with a manual, doesn't come with a guide. You don't get lessons and courses that, like when you get a driver's license or, when you have to take a course. Here you just get thrown good luck, and you can maybe use some of the things you got from your parents and some things that you get from your friends and stuff that you see online. But we know that a lot of that isn't either reliable or helpful or sometimes even damaging to children or to ourselves. And so the role of the Global Parenting Initiative, Parenting for Lifelong Health, and other collaborators in the space of parenting interventions is to give parents the support they need, the advice that works, and doing it in ways that we have rigorously tested and evaluated so that we know that it is advice and skills and behaviors that actually will support parents and their children to be able to protect them, to be able to help them thrive, and to be able to learn and grow together so that children can grow and be the um, uh, wonderful beings that they want to be in their lives. So the work that we do in the Global Parenting Initiative is to really look at ways to scale evidence-based parenting support that's been shown to work over 450 randomized control trials around the world. Um, and to find ways of doing that that are cost efficient and time efficient and human resources efficient, both thinking about the burden for the service provisions and the systems that provide that, and the burden that is for parents themselves and the time that it requires them to receive this support. And so a lot of the examples you hear today are looking at ways that we have been able to innovate this across different contexts. So I'm going to now hand it over to Dr. Amalee McCoy, who's going to take us through the rest of the session. I'm really excited to be part of the conversation. Thanks, and over to you, Amalee.
Great, and thank you so much, Jamie, for those opening remarks. I'm really pleased to have the honor to moderate this distinguished panel. There's a wide range of expertise here from 5 countries in the region, and I'm really looking forward to a very dynamic discussion. We will go through a series of questions grouped into 5 different topic areas. So you'll be able to hear from all of them according to different topical categories. And then at the very end, we'll be able to field some questions from participants attending this webinar. So without further ado, I'd like to pose an opening question to all our panelists, and we'll go one by one. But the question is, please briefly describe your role in supporting parenting in your country, followed by what you see as 2 or 3 of the main challenges that you have encountered. So let us start with Dr. Zuyi Fang from China.
Thank you very much, Amalee. Hi everyone, my name is Zui. I'm from China. I'm based in Peking University. I am an assistant professor at the Institute of Population Research in Peking University. So I work mainly on developing, adapting, and evaluating evidence-based programs like Parenting for Lifelong Health, Parent Tax Program. And my focus has been on making parenting resources more accessible, culturally relevant, and disability inclusive. For example, working with preschools, foundations, and NGOs, and also local communities to reach families of children with and without disabilities, and those in rural areas. And from this work, I would say there are 3 big challenges. First of all, access, as always. The parenting support is still very uneven, with most resources concentrated in cities, while rural and migrant families often have less support. And the second, academic pressure. So the education-focused culture in China continues to shape parenting in quite intense ways, which can make it hard for parents to focus on, for example, emotional connections or children's broader development. And also, I think the third one is turning policy into practice. So the government has made strong commitments to parenting and family education, but still we need more practical, scalable, and evidence-based models that can work consistently at the local level. So that's it. Thank you.
Great, thank you so much, Zui, for succinctly outlining those 3 challenges. I'd like to move on next to Dr. Sombat Tapanya from Thailand.
Thank you very much. As a senior clinical psychologist in Thailand, I've been working in the field for many, many years, going through different parenting programs. And my current role is to be an advocate at the national level. I have been a member of the National Child Protection Committee, so I have an opportunity to meet with the board and present our work and push for the policy on parenting support in Thailand. The other activity that I've been involved with is to connect our team with the local donors or funding resources. So we have several of them, particularly one is called the Thai Health Promotion Foundation, which has a huge amount of money from what we call sin tax from alcohol and cigarettes. So they provide those funds for research and activities that are promoting health for Thai population. And I have a good connection with that kind of organizations. So I guess that's my main function in this area. That's about it.
Thanks.
I think.
Do you want to outline 2 or 3 of the main challenges that you've encountered in the Thai context as well?
Okay. It's because the Thai government, there are many ministries involved or responsible with parenting or children, family, but they don't have any kind of coordination. So they work independently, and sometimes they overlapping or repeating each other, or maybe there's a hidden competition. So there is no really strong collaboration among the different sections of the government and maybe even the civil organizations, the non-government organizations as well. So that's, I think, the main challenge. And during the past years, we have been trying to coordinate this and create some kind of network, which I can elaborate later on, so that we can improve this situation. Okay.
Great. Thanks so much, Dr. Sombat. With that, I'd like to move on to Janelle Reyes from the Philippines. Please proceed, Jen.
Thank you, Amalee. Good afternoon, good morning, everyone. I am Janelle Reyes. I'm the Executive Director of the Masayang Pamilya Organization, Inc. So our organization adapts, enhances, and tests evidence-based parenting programs for families with kids, families with teens, and teen parents in various contexts here in the Philippines. So we've adapted and implemented parenting programs within the conditional cash transfer of the Philippines. We call it the Pantawid program, in residential care facilities and also in local government units. We are also scaling these evidence-based programs within the existing programs, just like what I mentioned earlier, just like the conditional cash transfer or Pantawid. So for us, Amalee, here in the Philippines, I think parenting is actually seen as important. It's we see that parenting can help or can aid different social issues. However, it's seen, but it's not actually being prioritized at the moment. So there's always an issue when it comes to accessibility of the parents to the parenting programs, or sometimes there are parenting programs, but when it comes to the implementation, there's a lack of follow-ups, or actually even the quality or fidelity of the implementation of the program. And most of the parenting programs that we have here, or parenting in general, is mostly focused on the knowledge level, that they know about it, they know what to be done. But when it comes to skills on how to do it, that there's a gap. So there's also a concern about the accessibility of parenting programs, and also the stigma that when you're a parent and you're attending a parenting program, there's something wrong or you're a bad parent because you need additional support or help. And in the Philippines, parenting is seen as something that is very private or should be discussed within the family. So there.
Right. Thank you so much, Jen. Seems like a very common challenge that is faced in many contexts in Asia in terms of help seeking and that being considered as acceptable socially. So thank you for that. I'd like to move on to Ha Tran Tu from Vietnam.
Thank you, Jen. Good morning, good afternoon, and good evening, my co-colleagues global. My name is Ha Chen. I'm the co-founder of the Early Journey of Life. It is a parenting program implementing in the country, Vietnam, and also currently I am the director of RTCCD, a research-based NGO in the country. So as you know, in Vietnam, working in the area of parenting and education, I can see the most challenging is how to transform the evidence-based innovation from the pilot phase, from project-based intervention into the full-scale implementation. It means nationwide scaling up. It is very challenging because if we don't embed that good practice into the routine national care, it could be faded when the international dollar added. So for the integration, it will require not only the strong evidence and advocacy, but it also require a good alignment with the government system, a sustainable financing. And also, I think it would require a practical model that can be adopted as well. So I think that is the most challenge in Vietnam right now. Over to you, Amalee.
Right. Thank you so much, Ha. Again, these are challenges that I'm sure resonate across all of our contexts and beyond in multiple countries in the region. And so finally, but definitely not last but not least, is Professor Rumaya Johari from Malaysia.
Thank you, Amalee. Hi, everyone. I'm Rumaya Johari, professor in Family and Child Ecology from Faculty of Human Ecology, University Putra, Malaysia. Together with Prof. Lakshman, Jimmy, we co-lead a research and program of Naungan Kasih, Positive Parenting Program in Malaysia. We started in 2018. First, we focused on the in-person program. Then came COVID. Then we slowly started working with the hybrid program, and currently we just finished our post program data collection on Naungan Kasih, parenting for parents of children at preschool age with one of the government agencies in Malaysia. So in terms of challenges, I think all panelists have raised my concerns as well, although that will be from maybe some variation in terms of density, but to ensure changes takes a lot of courage. Then we want the changes to become impactful, and then from impact we need to ensure that it's sustained. I think that will be the biggest challenge of all. So back to you, Amalee. Thank you.
Great. Thank you so much, Professor Rumaya. And that's a very helpful reminder for all of us that changes take a lot of courage. That's very true indeed. So thank you for these opening remarks. I'd now like to go into the more substantive part of our discussion. I'm going to ask a few questions about values and social norms in relation to parenting programs and scaling those programs. And I'd like to focus these questions on our panelists from China and Malaysia. So for Dr. Zhu Yi first, could you please tell us about this particular topic, which is parenting in China has deep cultural roots in Confucian and collectivist values. How do these values continue to change and shape parenting today, especially with the strong emphasis on education?
Thank you, Emily. That's a great question. So Confucian and collectivist traditions still have a very strong influence on parenting in China. Confucian values emphasizes family responsibility, respect for authority, and also children's duty to, for example, bring honor to their family. And because of this collectivist culture, parenting is often seen not only as a private matter, but also something that reflects the family's reputation and also contributes to the social harmony. And this is most visible in the emphasis on education, as you mentioned. And academic success is still viewed as the main route to family and social mobility. So parents often feel a very strong sense of duty to push their children to excel, and sometimes at significant emotional cost. But I think in recent years, we have also seen a growing awareness of children's mental health, especially because the increasing prevalence of mental health challenges among children and adolescents. It has really made both the society and many families reflect on the roots of these problems and the importance of prevention. So as a result, more and more parents are starting to value positive and non-confrontational approaches to parenting. For example, people start to focus more on emotional connection and communication and understanding the children's needs rather than only on discipline and or achievement. So I would say traditional values still shape parenting deeply, but they are now being reinterpreted in light of new social realities and also the growing concern for children's emotional well-being. And thank you. Back to you, Emily.
Thank you, Dr. Zhu. That's, I think your points that you're raising are really important, that many of the values that we see in our context, they're not static. They're often very strongly shaped by tradition, but there's growing awareness of the need, especially to respond to children's well-being and mental health. And current contexts are changing rapidly, and so there's a space there for our work in promoting parenting interventions. I'd like to move on to Professor Rumaya from Malaysia.
Yes,
And for your question, in Malaysia, there's been a gradual shift from authoritarian to more positive parenting approaches. What is driving this transition, and how are parents embracing nonviolent supportive practices in daily life?
Thank you, Emily. I wouldn't say it as a major paradigm shift among every parent, but there is gradual changes. Then basically, increase of awareness and knowledge of child development has been a strong drive for these changes. And the influence of modern values that see children do have their own rights and need emotional support to excel or to develop well. And parents have realized that non-violent, more supportive, a clear balance between control and support as a tool for better development of children that can enhance self-concept development, social skills, and independence among children. So parents have been seen to adopt a more warm and authoritative, a balanced parenting style, democratic, that ensure, although they are more lenient, but clear boundaries are still there. So what is more interesting, that great awareness in terms of the harm of harsh parenting. I think that's also resonate with where the faith-aligned parenting messages from interfaith system messages that are being talked about by many, including researchers, and where warm parenting is favored over others. And all this, I think, we are getting there. somehow we are getting there. Although there are still small sectors of parents who still have strong belief about, how the harsh parenting have made them the person they are today. But slowly we are changing. So I am quite positive about this, and I see parents starting to grasp all these new skills by having good open communication with the children, give reasons, and also invite children to share their own sets of feelings and questions as well. So that's positive about that. Thank you.
Great. Thank you so much, Professor Rumaya. Again, seeing really positive changes with regards to social values and norms in Malaysia. I think you put it well, saying there's now a growing balance between control and support, which is a welcome development. I'd like to move on to the next topic, which is focused on national strategies and priorities on parenting. And I'd like to pose these questions to Thailand, Philippines, Vietnam, and China. We'll start with Dr. Sombat from Thailand. My question is, in the absence of a concerted national policy on parenting, what are the particular challenges to scaling parenting programs in Thailand?
Okay, thank you very much. This has been our concern during the past few years in our advocacy for a national policy on positive parenting, because as I mentioned earlier, in addition to having a number, maybe 3 or 4 ministries, having responsibilities on supporting the parenting program, they don't have any kind of law that would support the actual implementation of the policy. And there's no clear mandate or policy among these various ministries. So it seems like when we meet with them, they don't have a very clear idea of what they want to do or what they should do. And typically of Thai bureaucracy, government officials, there are very few people who are well educated in like research or at the high academic levels. So, and they are also influenced by people who hold political positions that often also don't have a clear idea about parenting or the importance of the work. So everything is kind of murky and confusing. So it makes it very difficult to navigate among different authorities in different ministries. So despite our very extensive work that we have already trained or deliver the program, the PLH YC program to over 1,500 parents, and we have trained over 600 facilitators. We still don't get like a really clear acceptance from any particular ministry. We've been working mainly with the Ministry of Public Health, but in addition, we also work with the Ministry of Social Development and Human Security, and they have Department of Children and Youth and Department of Women Affairs and Family, but they really don't have really clear direction on how to get all this done at the practical level. So that's our challenges. We're struggling in like communicating with them and get their really strong support. So, but we are working on it. Thank you.
Thank you so much, Dr. Sombat, for highlighting those challenges, which I think resonate again across multiple countries in our region. I'd like to move on to Jen from the Philippines. Parenting support and early intervention are relatively new priorities in the Philippines.
Yeah.
Can you please describe what has driven this change?
Yeah, thank you, Amalee. So, actually, there's been different programs to promote parenting in the Philippines. So we have PES, or the Parenting Effectiveness Sessions, AirPath, which is Empowerment and Reaffirmation of Parental Abilities, which is actually focused more on male involvement. However, what's lacking was the consistency in the implementation and support from government to ensure the quality of implementation. And more often than not, the focus of these programs is actually on knowledge rather than practical and relatable parenting skills. So there's inconsistency when it comes to the implementation. However, in the recent years, the change in prioritizing parenting support has been driven primarily by the alarming findings from the National Baseline Study on Violence Against Children that was conducted in 2016. So in this study, it actually the data showed that 80% of Filipino youth who participated in that study experienced different forms or kinds or somewhat form of violence during their childhood. And a significant number actually experienced it at home. Often the perpetrators were parents or members of the family. So this data, this evidence actually sparked a movement led by Dr. Bernie Madrid of Child Protection Network, and it's supported by institutions like Ateneo de Manila University, which is under Dr. Lian Peña Alambay. We know that this is what's happening. So what do we know now? They want to create, develop, and implement evidence-based parenting program that's actually aimed to address that issue of high cases of child maltreatment at home. So this was when Masayang Pamilya program was actually born through adaptation with the Sinibuyo project in South Africa. Also, additionally, in the last 2 or 3 years, I think, there's the enactment of the Republic Act 11908, which is the Parenting Effectiveness Service Law that is mandating the implementation of parenting interventions across in national level in the municipalities and cities in the Philippines to protect children and promote evidence-based positive parenting practices. So because of these two significant happenings, the what we call the NBS VAC and also the RA 11908, there's a recognition that there's child abuse within homes, and dealing with that, how we can address that is having law or through a legal backing so that we'll have a more consistent implementation and evidence-based approach when it comes to supporting Filipino parents when it comes to parenting.
Thank you so much, Jen, for sharing that. And it's really inspiring to know that research, especially prevalence of violence against children, research at the population level can be a catalyst for inspiring action at the national level. So that's been the case for quite a few countries in the region as well as globally. I'd like to move on to Vietnam, and I'd like to pose this question to Ha. What evidence from your randomized control trials and longitudinal studies has been most influential in securing government or donor buy-in?
Thank you, Amalee. So, as Dr. Jenna and Amalee has expressed, that in order to convince the government, we need evidence. Policy makers, they prefer statistic. They would like to read all the statistic for their decision making. So we received an order from Ministry of Health in Vietnam that they would like to see how the early childhood development program that we're implementing in Vietnam, how it have an impact on the children, how much does it cost, and is it feasible to implement that at the national scale using the national budget. So based on that order, we conducted the cluster randomized controlled trial with nearly 1,200 diet of mother and child. We follow them from mid-pregnancies until the child is 24 months of age. And here, I would like to conclude to you that two key findings that were impressed by policymaker and the international donor. The first one, it is the impact, the significant impact of the intervention package on child development. So the intervention demonstrated that the children in the intervention cohort have improved the cognitive, language, and motor development, significant, much higher than those in the control cohort. And we also found that children in the low-income family and children whose mother have a limited education benefit much more than those from the wealthy family. So it contributes to reduce inequity in the country. That is what policymakers love to hear. They committed to eliminate inequity in the society. The second finding that they lack is the cost effectiveness. So in our cluster RCT, we found that the investment of $14 per child, $40 per child in the whole program of 2 years, it will increase 1 score of child cognitive development. So that equal to 0.5 GDP of Vietnam. And as you know that, in order to increase 1 score of cognitive development in the developed country, it will cost 2 GDP. So you will see implementing in the Asia, in Vietnam, is more cost effective. And these findings really get the buy-in of the policymaker. They want to know if the government can afford to buy it as the model. So based on that, the Ministry of Health has worked with their sub branch, for example, the National Immunization Office, and they are working with WHO office in Vietnam. And right now, they gave us permission to expand the early journey of life to 5 provinces in Vietnam. And now it is implemented province-wide and under the government operation. So my conclusion to you is that for your evidence-based research, focus on not only the impact measurement, but also the cost effectiveness in order to increase the appetite of buy-in from the government and international donor. So that's my sharing. Thank you.
Thank you so much, Ha. That's really impressive, having evidence on effectiveness and the costing can produce really inspiring results by the government. So thank you for that. Finally, I'd like to ask Dr. Zhu Yi from China. With the introduction of policies like the Family Education Promotion Law in China, how is the government's role in supporting parents evolving?
Thank you, Amalee. That's a really important question. The Family Education Promotion Law, which came into effect, I think back in 2022, marks quite a big shift in how the government views its role in parenting support. Because in the past, parenting or family education, as we call it locally in China, was often seen as a private matter, something for parents to handle on their own. But now the government is explicitly recognizing that parenting is also a matter of public concern and social responsibility. So I think what we are seeing is a gradual move from educating children to also supporting parents to parent. So the law emphasizes that all parties, schools, communities, and local authorities should all play a role in guiding and helping parents, not just evaluating children's performance. And also in practice, I think this means more parenting programs and integration of parenting support into community services. And the challenge, though, is consistency and quality. So how to translate this new national policy into effective and also evidence-based parenting programs at the local level, especially in under-resourced areas, is still something we are all trying to explore. But overall, I think this shift shows growing recognition that good parenting is really foundational to child development, and that supporting parents is now seen as part of building a healthy and future-ready society.
Thank you so much, Dr. Zui, for those reflections. I want to move on to the next category, which is on scaling parenting programs, which all of you have experience in doing, working on directly as well as with colleagues and partners. And so I'd like to pose these questions to the Philippines, Malaysia, Vietnam, and Thailand. I'll start with Jen. So Jen, could you please share some examples of innovations that have helped scale up parenting support in the Philippines? Jen, I'm not sure if you're
Performance
you're in
structures. It's
okay. Sorry, go ahead.
Hello. Wait. You hear me now? Wait, give me a second.
I can.
I'll just make connection.
Okay, great. Thanks, Jen. I'll move on to Professor Rumaya, and then we'll come back to Jen. Professor Rumaya, initiatives like Nunggan Kasi and Parent Text have shown promising results in supporting families. What lessons from these programs could be scaled up nationally or even adapted in other Asian contexts?
Thank you, Amalee. There's a quick translation of Naungan Kasih. Naungan Kasih is in Bahasa Melayu, Malay language. It means protection through love. Okay, so this is a positive parenting program, which is a group-based family strengthening program for families with children. We initially started for the age of 0 to 18, and the aims of the program partly is, of course, to promote child well-being by helping parents and supporting parents develop skills that are much needed to establish. We really focus on establishing positive relationship, good relationship between parents and children, while trying our best to reduce a risk of violence at home and within the community. So that's the overall overview of the program. And lesson learned, of course, I would like to share a bit on in terms of the findings of our pilot studies that can be shared here. The programs have shown reductions in parenting stress, child abuse, and behavioral problems, while improving child development and parent-child relationships. And these are based both on the in-person program as well as the hybrid program that we did. So over the years, we have gradually lived the whole package of just in-person program to hybrid program. And I just would like to highlight some of the points that made, I think, worth to be scrutinized by other member countries that who wish to adapt or adopt this program. Among the lessons that we learned, having this program delivered as a hybrid mode, where we combine in-person session with digital platforms like chatbot and WhatsApp group support of support accessibility and for flexible parenting education. So the approach, which is hybrid, helps reach more caregivers. In fact, this is one of the pulling factors for fathers to be involved as well, because they don't have to come many times to meet with the educator or the facilitator. later they can just be on their own while scrolling on the parenting tips. And this also the package when it becomes hybrid is also accessible for those in low resource or low income settings while maintaining personal support. So that would be the in terms of delivery. In terms of content, when we develop the program, the module itself, one of the key things that was shared throughout the trainings and whatnot is the content must be contextually adaptive to people who will be receiving it. So we involve stakeholders and the partner, our government partner, which is working with us at this point, which is the Department of Community Development under the Ministry of Rural and Regional Development of Malaysia, or the acronym is KEMAS. They have preschool all over Malaysia. So we have welcomed their officers to join the co-design workshops over the series of co-design workshops and meetings, where we found out actually they do have their own parenting program that they have established for quite a number of years, with of course a different tone and different focus. And we try to encourage them to put forward what are contents from those established modules that they would like to see in the current module. So they have suggested two major contents that we have adapted, put it under two goals on focusing on nutrition as well as school readiness, which includes literacy in terms of maths and language. So that the welcoming idea that their input is important makes the programs felt belong to them. So I think this is one of the most impressive to get the buy-in by our partners. So that's contextual adaptation. And we also have facilitated support infrastructure for this program. For the one that we are doing now is with parents of preschoolers, with one government agency that has coverage all over Malaysia. And every year they have new preschool students and new parents. So the program has high potential for scale, and we use also the program as capacity building for the teachers of these preschoolers, where we teach them we teach the parenting knowledge and skills through the training, not only to just facilitate the inputs, or the contents for the parents to use, but for them also to learn about parenting. So this is of course for personal benefits, as well as this encourage the teachers to also try and use this, because the major content also reflect adult-child relationship. So we have received good feedbacks from teachers where they have also used the content in classes. So that's like killing. No, Jamie doesn't like killing things. So we have one good intention that can, many goals that can be achieved with one move. And we also have, I think the underlying focus of the whole module is strengthening parent-child relationship. I have always used this idea that some of the parents who have gone through our program keep on asking whether they will receive more programs when their child is getting older. So we highlighted that the message about focusing on strengthening parent-child relationship is the very big foundation of all. So you have to adapt. Once you have established the relationship, whatever challenges that come in the future should be made ease for that. So we have to really be strong on that first before we can build up other things. So we nurture the relationship. We provide skills to support positive behavior, daily routines, and things like that. And working with the government services, we have also considered, we tried our level best to find agencies that have institutions like preschool. So they have clients, all throughout the years, and they have support and structure to do that. And the plus and bonuses like having their own parenting program is something really beautiful. While the program must also to keep up with the evidence-based part. Here comes my team and I. What we do is for the research, monitoring and evaluation, where at this point we just finished our post program data taking for our RCT, and our pilot results before this have shown many promising outcome. So we do hope this
Thank
program
you.
can be scalable. Thank you, Amalee. Back to you.
Thank you, Professor Rumaya, for sharing. all of those promising lessons. And I'd just like to note that it's quite interesting that you mentioned that delivering a parenting intervention is in hybrid mode was found to be a pull factor for fathers and made to be more accessible in low resource contexts. That's quite a very powerful finding, and perhaps also relevant to other countries. I want to move on to Ha from Vietnam. So Ha, government timelines and external funding cycles often don't align. What strategies have you found most useful for maintaining sustainability and scaling efforts in Vietnam?
Thank you for that question. I think it is the common situation in all the country. There will be a misalignment between the government funding and the international funding. Money will never come at the time we expected. It is always delayed. Not sooner, but always delayed. So how should we deal with that? In Vietnam, from our program, we see there are 3 strategies that can help to address the issues. So the first strategy that we use is to be close friend with the government agency here for Vietnam, Ministry of Health. We keep a proactive engagement with the Ministry of Health in Vietnam. And we keep a very close contact with the subnational health authority in order to encourage them, to promote them, to mobilize their provincial budget for early childhood development. So how do we do that? We share the newsletter with the Ministry of Health and the provincial local partner about ECD innovation. We update with them about the research finding. We share with them with any new recommended WHO framework and recommendation for good practice. We be side by side with the Ministry of Health to develop the national policy on early childhood development. And we gently embedded our early journey applied innovation into the national policy. And we also show them the material that convince them about it is cost effectiveness to implement the early childhood development in the country in Vietnam. It will contribute to boost the population's quality, to contribute to the growth of the country. That is what policymakers love to know. So that is our first strategy. The second strategy is to identify an optimal national program to integrate with the ECD. As you know, I don't know how about in another country, whether it is easy to set up a national program for ECD, but in Vietnam, the Prime Minister have an issue, a document. It said that no further new national policy is established. So for early childhood development, we first recognized by the national policy by 2018, very new, 2018. So we did not have a chance to be national policy. And we have to conduct a survey with many policymakers, with the health manager at a provincial level, at the community level, and we identified that national immunization program is a good program that can be integrated with the early childhood development. And that is how currently the early childhood applied program in Vietnam has been embedded into the routine immunization program monthly. And it does not cost because parents bring the children to community health clinic for immunization. They have to stay 30 minutes after the shot to monitor any side effect. And now they stay back, use those 30 minutes to learn about parenting education, to learn in practice. And at this moment, the early childhood applied reach out to 6 out of 34 provinces in Vietnam. So it means that our coverage is 12% of the total population of Vietnam. We have 100 million Vietnamese people, so 12% coverage. And that is our second strategy. And the third one, it is about the model. The model should be structural, simple, and scalable program. Why I say that? because we know that when, as the academic people, we would love to build up an idea program with a lot of components, multiple components, a lot of sessions to practice. We would like to add in everything because in our statistic analysis, everything contributes to the impact. But in the reality, we have to consider to what extent the parents can come to attend the parenting education session. To what extent the health worker and community facilitator can deliver the session in their routine work, especially when there is no international donor funding. So in that way, for Vietnam, for our early learning apply, we only established 12 sessions to implement from pregnancies until the child is 2 years old. And the content will be 9 of that 12 sessions fit well with the national immunization program. 3 sessions will be delivered in the vitamin A supplementation campaign, which is delivered twice a year in June and December. So in that way, we embedded into the national program smoothly, and health worker did not find it a burden. They find it a help for them to make the 30 minutes waiting to be the 30-minute learning and practice parenting education skill, and parent love to stay back and learn the skill. So those are the 3 strategies that we use right now, and it seems working well. So, thank you.
Great. Thank you so much, Ha. That's very inspiring, actually, all these successes and these strategies, working closely with the government, identification of an optimal national program that can be integrated with ECD, and recognizing that the model should be simple and scalable. Those are really powerful results. So staying in line with the sector of the public health environment and scaling within public health, I'd like to move on to Dr. Sombat before I get back to Jen again with repeating her question from the beginning. But moving on to Dr. Sombat, I'd like to ask what lessons can be drawn from national level collaboration in promoting knowledge exchange and parenting program coordination?
It's a very complicated process to gain the national collaboration, because as I mentioned earlier, there are many players involved. And in addition to that, we also work with our target population is low income and low education parents. And also we have a very large number of ethnic groups in the border areas. So these are additional challenges that we have to struggle with. However, we start to feel that we have been receiving more recognition, even though it's still not at the level that we are confident that there will be any practical level of activities at the national level. But we have been maintaining positive relationship with different ministries, and it seems like there is a potential there that if we continue working on this, we can see like the silver lining. I guess we have hope for success in the near future. Our strong point, I think, is our creation of the community of practice that we have started since 2022. And we have been very active, creating activities such as webinar. We have conducted over, I think, 18 webinars so far. And we have over 1,400 members, subscribed to our newsletter. And we have increasing number of people becoming more involved in our activities, and we are kind of gaining more recognition from the government sectors, as well as some of them expressed their interest in coming to work with us in this community of practice on positive parenting. So that's the area that we feel hopeful that at some point we will gain a very strong foothold, and substantial support from different parts of the government will become clearer. So that's our optimistic view at the moment, I guess. Okay, that's about it.
Yeah.
Thank you. Back to you.
Okay. Thank you so much, Dr. Sambat, for highlighting the very real challenges, but also some of the initial successes, especially with the national Thai Positive Parenting Community of Practice that the Peace Culture Foundation has been chairing. I want to get back to Jen from the Philippines. I'm just going to go over that initial question again. Could you please share some examples of innovations that have helped scale up parenting support in the Philippines?
Yes. So just like what I mentioned earlier, here in the Philippines, scaling up parenting support has been notably facilitated by leveraging existing national and local government structures. So for us, this existing government frameworks actually provide established capacity and a clear target population for the parenting program implementation. So it's making the scaling more efficient and far-reaching. So for example, in our case, an innovation that actually helped scaling a parenting support effectively is the integration of the Masayang Pamilya program. It's an evidence-based parenting program intervention into the online family development sessions of the Pantawid Pamilyang Pilipino, or 4Ps. It is the Philippines Conditional Cash Transfer Program. So this initial collaboration actually happened during the pandemic around 2021 and 2022, because that's the time that we all shifted online. And that's the time that also the conditional cash transfer needed support when it comes to providing online resources. So the digital component enables wide dissemination, the parenting messages to around 4 million beneficiaries of the 4Ps. So it actually showed how digital tools like online modality combined with established CCP infrastructure can enhance reach and fidelity in the parenting program. And also because of this initial collaboration, it started the further collaboration or working together between to integrate evidence-based parenting program within the CCP here in the Philippines. So that's one. Another example is scaling the parenting support program through the local government unit. So because with the conditional cash transfer, it's more of the national level, nationwide, the entire Philippines. But another way of scaling the program, parenting program support here is through working with different local government units. So this one, it's effective in having partnership with the local social welfare offices to capacitate their social workers, their early childhood supervisors, their community service providers, and they are the ones who are delivering the program to their communities or beneficiaries. So an example of this one is the MAPA chat program or Masayang Pamilya chat program, which is an online parenting support. Again, the initiative started during the pandemic, and it was delivered through an online group chat. And it's implemented initially in Valenzuela City. And later on, it's adapted by another LGU, which is Makati City, and now being implemented in other LGUs. So in this case, in my example, it's very important that you know that you cast your net wide, that it's not only in the national level or only the local level, but for us, diversifying the innovations, and at the same time, your partnerships and collaborations actually support scaling the MAPA program.
Great. Thank you so much, Jen, for highlighting those two amazing innovations. And I think many other countries are aspiring to reach that level of coverage that the Philippines has reached, reaching over 4 million beneficiaries, and having the conditional cash transfer system be that conduit for reaching that target group. And also, thanks for highlighting the MAPA chat program and the benefits that have been achieved through that intervention. So I'd like to move on to the next topic, which is on political and social challenges relating to parenting programs. And so I'd like to focus on China, the Philippines, and Malaysia for this category. I think we might have to try and keep our responses a little bit tight. So maybe in 2 or 3 minutes, if you could try to limit your responses to that, that would be helpful. So the first question is for Dr. Zhu Yi from China. What are the biggest challenges facing parents in China, such as academic pressures, socioeconomic disparities, or intergenerational caregiving, and how are families navigating them?
Thank you, Amalee. And yes, I think parents in China are facing the exact 3 challenges you mentioned just now. So the first one is definitely academic pressure. The education system is still highly competitive, and many parents feel that their children's future depends on academic performance, and that is to a great extent very true. So this creates a lot of anxiety, not just for children, but also for parents who may feel judged by their children's achievements. So some families are trying to push back by focusing more on children's, as we just mentioned, emotional well-being and overall health, and trying to create a more balanced routine, but still it's not quite easy in a results-driven environment. And the second challenge of socioeconomic disparity, as you mentioned, is also true. So urban parents often have access to more resources, but rural, migrant, and left behind children face real barriers. And many parents in these groups want to be more involved in parenting, but are really constrained by work demands or distance. I think digital tools are starting to help bridge some of these gaps. And that is also something we're trying to explore with GPI and PLH and local partners. And also the third challenge, as you mentioned, the intergenerational caregiving is such a local reality. Grandparents really play a huge role in childcare in China, which can be both a strength and also a source of tension, because differences in values, for example, around how you discipline children and the independence of children or emotional expression often create great friction between 2 or 3 generations. And more families are learning to communicate or share responsibility more intentionally intentionally, but still it's a very complex dynamic to navigate. So the intergenerational caregiving is not a new issue in the society at all. But currently there is very limited scientific evidence on this topic. So there are a lot of exploratory work that needs to be done, I think. Thank you.
Great, thank you so much, Sui. That's very interesting for us, I think, across the region in terms of the academic pressures, the disparities between urban and rural families, and also the pressures of intergenerational caregiving. I think those challenges could be shared quite widely. I'm going to go back to Jen in the Philippines now on this issue. So I'd like to ask, how do frequent political transitions affect continuity in parenting programs? And how have you managed to keep momentum?
Yeah, so I think this is a topic that we usually talk about when we had our regional meetings. And this is not isolated here in the Philippines, but I think also in other Asian countries. So frequent political transitions can actually impact and challenge the continuity of parenting programs. I remember we started talking to this leader some years ago, and then suddenly there's a change in governance. So we had to do it all over again. And I don't know how many times we've had courtesy calls or introduction of the intervention program and the importance of parenting in the last 8 years. But changes in political leadership, these changes often lead also to changing priorities. When you change priorities, you also change budget allocations, and the focus of the program is also being changed. So sometimes different government leaders, they have what they call the flagship program. So that's their mark, or that's actually what they want to be known for. And since parenting initiatives rely heavily on the commitment and support of local executives, leadership changes can result to inconsistent implementation or even discontinuation of programs. So stronger for us here, and so far what we've been doing is that stronger and continuous advocacy of parenting programs actually play a crucial role in sustaining and scaling support for positive parenting practices. So advocacy efforts focus on raising awareness, building partnerships, not only with government units, but also other CSOs or community service organizations, and championing evidence-based interventions across multiple sectors. So you're including the local government units, you're including the social welfare agencies, even universities and other stakeholders, to make sure that we spread and sustains the advocacy when it comes to parenting. Advocacy also involves generating data and evidence. Every time we go to local government units, they'd say, so what's the proof? What's your proof that it's actually working? Show us not only numbers, but also anecdotes from the parents who actually participated. And this evidence, it will demonstrate the effectiveness of parenting programs. And once we're able to secure that, there's also it's also followed by commitment from policymakers and local leaders. So for example, so far the studies highlighting positive outcomes from the MAPA program reinforce the importance of investing parenting support as a community or government priority, showing that there's a reduction in child maltreatment, or there's a reduction in parental stress, and there's an increase in positive parenting behavior. And also, the passage of the Republic Act 11908, the one that I mentioned earlier, which is mandating the implementation of parenting programs, is helping us in advocating parenting programs initiatives legally. So this is creating an obligation for incoming administrations to support, sustain, include in budget allocation, even whatever the political atmosphere is. So that's, I think for us, that's our way of making sure that we are able to keep and continue to advocate about parenting programs and their benefits in the community.
Great. Thank you so much, Jen, for that. And so highlights from what you were saying is about the important role of stronger advocacy for sustaining interventions, championing interventions across multiple sectors. I liked what you said about for data and evidence, we don't just need numbers, you need anecdotes as well. So numbers and anecdotes. And also the passage of the government mandate, really providing the context for further advocacy and pushing forward for scaling. Finally, I'd like to pose a question to Professor Rumaya again in Malaysia. Your question is, parents today in East and Southeast Asia face pressures such as long working hours, rising living costs, academic expectations, as well as digital risks. Which of these challenges do you see as most pressing in Malaysia, and how are families responding?
Thank you, Amalee, for the question. I think being trained as a family ecologist, I cannot find out just one single answer among those challenges. Ecologically speaking, all these factors are intertwined. They are influencing each other or influenced by each other at different levels, from individuals to the diet of parents, husband, wife, or even if they are divorced, as well as the macro system level. Just to highlight on financial constraints, so economically, most parents from the lower ends, the low cost, low income families may have to work 2-3 jobs at one go. And people complain on having very limited time to deal with parenting matters. And so they have not enough time to engage and whatnot. We have seen this evident by the anecdote, the qualitative findings, when we introduced spending 5 minutes with your child, where some working mothers reported that they didn't realize actually they have so many 5 minutes. So that's, having the skill to do things might change the perception a bit in terms of not having enough time. And we have to take note on that. People do have financial constraint on top of having all these limitations. Of course, emotionally, people can get easily disturbed because they're tired, time is limited, and when they get back, and if they see children are not performing or not behaving well, they might get into harsh parenting. So this is again something that is linked with each other. And of course, the focus for digital challenges, parents are not born with that challenges. We are not trained, we are not even exposed to it before, yet now we are facing with that all kind of challenges. And thank God, established systems have been doing their parts as well to educate parents to move on. And I think words like mediation, being there, following the children in terms of their digital activities have been helping as well. So yeah, thank you.
Thank you so much, Rumaya. And I think it's really telling because we have some of the longest numbers of working hours in our region. So this is always very pressing in terms of how to encourage families to spend even 5 minutes with their one-on-one time with their child. It still sounds very short, but it's still a big obstacle for many families, especially those who are working, multiple jobs and who have limited means. We are a bit short on time. However, I'd like to pose these final 2 questions to Thailand and Vietnam. These questions relate to working with marginalized and vulnerable groups. So if you don't mind to please keep your response limited to about a minute or so. So Dr. Sombat, I'd like to ask, what are the main barriers to scaling parenting programs at the national level in Thailand, while also trying to reach particularly marginalized and vulnerable groups?
Yes, thank you. The difference in culture and language would be the main obstacles, and not to mention the geographical locations. A lot of the ethnic groups are in the mountains or on the borders of the country and make it difficult to reach them. So we recently we have been working with NGO who work with this particular population, and we have to create new or translate our manuals or adapt, into the languages that are required to work with them. So that is a big burden for us. But, well, 1 minute is over, I think.
Right.
Thank you.
Thank you. Thank you for that, Dr. Sombat, and very challenging in context of Thailand, where there's at least 80 ethnic minority groups all over the country, including in very difficult to reach geographic areas. Finally, I wanted to ask Ha from Vietnam, how have you adapted parenting programs for ethnic minority groups and resource scarce settings in Vietnam, and what challenges remain?
Thank you. And as we know that when applying all the WHO recommendation and the evidence-based package from global to any country, we have to adapt for that. And in Vietnam, we use 5 steps of adaptation. The first one is community assessment. We begin with understanding how about the local context, how about the cultural norm, the caregiving practice, about the barrier to access. And then we conduct the stakeholder consultation to get the feedback to see if what we propose fit with the community's needs and value. And then we do cultural tailoring. It means that we bring the content is adapted aligned with the culture, belief, and language, and filming their daily routine in the video making. Then we do pilot testing and refinement. So those 5 steps of adaptation for the ethnic minority and also for the people in urban and rural as well. As I answered the question from Dr. Jasmine in the Q&A box, we do that for the urban and rural as well. And we see that for the ethnic minority, there are at least 3 challenges. The first one is the language barrier. The ethnic minority people don't have a lot of technical terms, and even with their speaking term, they have to borrow a lot from the national language, and many of them don't have the written script. That may be very challenges. The second challenge is the diversified living condition. Even though they are the same ethnic minority, but living in different regions, they have different socioeconomic status. So we have to contribute a lot of effort in order to have one result. The third one is food insecurity. Even though we have very beautiful recommendations from the WHO or from the National Ministry of Health, but when we bring it to the field, the family don't have snack and food to feed to pregnant women and children daily. So we have to work with the agriculture program in order to promote planting the vegetable and fruit to improve home growth food availability. So those are the challenges that we feel like during the adaptation we have to face with. And I think it may be the issues in another country as well.
Yes, great. Thank you so much, Ha. That's for highlighting all those complexities of working with these particularly vulnerable groups. That rounds up the kind of more panel-focused questions. Just want to hand over to Jen because I know she's keeping an eye on the Q&A box. Jen, are there any particular questions that we can pose to some of our panelists?
Sure. Thank you so much, Amalee, for moderating that session, and to our panelists for your responses. There are a few questions in the chat, and I'm just going to pick up on a few. Thanks, Ha, for answering the question in the Q&A already. But just in terms of the chat, Whitney Richardson posed a question to Zui, and the question was around, it's a comment, it's a question. Deeply rooted cultural beliefs shape how parents view discipline, authority, and child rearing. What strategies, she's particularly referring to your comment around South Africa, Zui, what strategies have been found most effective for working within these cultural frameworks, especially when promoting new parenting practices that may challenge long-held norms?
Thank you so much for the question. I don't have that much experience in South Africa, but I can definitely share my own viewpoint based on my research and practice in China. So that's such really an important point, and it really resonates with what we've seen in China as well. So in many places, cultural beliefs around discipline and authority are deeply rooted in ideas about respect, obedience, and family hierarchy. So when introducing new parenting approaches like positive or non-violent discipline, is not really effective to tell parents or grandparents to just change, and what tends to work better seems to be building on strengths already presenting those cultural frameworks. For example, rather than framing positive parenting as something boring or modern or scientific, we need to connect it to existing values like teaching with love, modeling respect, or guiding children to become more responsible members of the family and community. This helps both generations to see that new practices are not replacing their culture, but extending it in ways that support children's well-being. And another effective strategy, as I observe, is using peer-led and community-based approaches. So where trusted local parents, elders, and health worker models and discuss new practices in familiar ways, and also show evidence through experience. So that's based on my own experience. And thank you for the question.
Thank you so much, Sui. There was another question posed by Sabine, and this was, I think, there isn't a particular person that it was posed to. I'm not sure if anybody on the panel would like to respond to this. Have you ever come across any countries or communities where parenting support is not needed because this is being provided adequately through intergenerational caregiving or other informal supports? I see Ha's already shaking her head. Would you like to respond to that, Ha?
I think the intergeneration path is very strong. But nowadays, with the availability of the internet, young parents, they're eager to learn more. And to them, nothing is enough. They would like to learn more in order to nurture their children well. So I think easily is definitely needed in every country, regardless they are developed, underdeveloped, and very developing country. And it should be taught to young parents when they are very young, and even when they are the children at the school.
Thank you so much. Would any of the other panelists like to comment as well, link to that? Zoe, I saw your comment. I'm going to pop it into the chat now, and Sabine can just see it. She'll get it over there as well as other people. If there isn't anyone else, let me just try and pull up one more question. This was from Kija. Kija wanted to know, and I'm not sure who exactly this was also pointed to, what had been the experiences of the co-design approach on sustainability and easy to scale up of parenting interventions? Kija, I'm not sure if you could just pop who particularly that was for, who spoke to scale up. Oh, here we go. I think she might have been off the call as well. But then she has a few other questions also. She also said it's interesting how the team identified and integrated parenting interventions into the immunization program. So that might have been her. Yeah, go ahead, her.
Okay, thank you. So we conduct an informative research with the ministry level, with the provincial health worker, even with the community-based health worker and the family. We pose to them 3 questions. Which national program that could be implemented even though there is no money? It is still implemented. The second question, what is the health-related activity that parents will always bring their children to and they never deny? And the third question, if this 12-session parenting education delivered to them, what is the most optimal way that they will attend? How it will be delivered? And with those 3 questions, the immunization program was proposed. And we asked those questions to people in urban, rural, and mountainous and ethnic people. We asked in a 6-month survey and qualitative interview, and that come out to that finding. So that is how we identify the immunization program in Vietnam.
Thank you so much. We only have 1 minute left, and I just wanted to give back to Amalee just to wrap us up as the moderator of the session to have the final word.
Great, thank you so much, Jen. And just to express a huge thanks to the panelists for this valuable sharing of expertise across quite a wide range of contexts and sectors in the social welfare, health, and education. We heard so much about different entry points and how you have identified various opportunities, encountered many challenges, but also have generated very valuable lessons learned for sharing with all of us. We've heard so much about how building on traditional values, but embracing evolving social norms is crucial to sustaining and to scaling parenting interventions in our context, and how you have identified innovative practices and entry points to increase access to families and given limited resources, and especially now during this time of austerity, which all of us are really facing. So thank you so much to everyone. I think this session, this webinar really highlights the importance of countries within the Asian region engaging in lots of active dialogue and sharing our experiences and lessons learned. So I hope this is the beginning of that. Thank you very much.